Good morning, everyone. Rob Bonta, California Attorney General here, and thank you for joining us as we announce our latest lawsuit against the Trump administration, our 36th lawsuit in 27 weeks, more than one a week, alongside 22 attorneys general and a governor's office. We're challenging the federal government's defund provision, a law that strips federal Medicaid funding from Planned Parenthood health centers. And we need to just call it what it is: punishment for Planned Parenthood's constitutionally protected advocacy for abortion. This provision is a direct attack on access to essential health care for millions who rely on Medicaid. To be clear, this isn't even federal funding that goes toward abortions. The Trump administration and Congress are actually gutting essential life-saving care like cancer screenings and STI testing simply because Planned Parenthood has spoken out in support of reproductive rights. The hypocrisy is really hard to ignore. A party that claims to be defenders of free speech only seem to care about it when it aligns with their own agenda. Rest assured, California will continue to lead as a reproductive freedom state and will continue to defend health care as a human right. We won't sit back while Congress and this federal administration tries to roll back our progress, silence their opposition, and ignore the rule of law. The defund provision isn't about abortion funding. Federal law already restricts abortion funding, except in narrow circumstances. Republican members of Congress and President Trump have consistently targeted Planned Parenthood for speaking out in support of abortion. Now they're weaponizing federal funding to punish Planned Parenthood and force states to fall in line. This isn't just about keeping federal dollars that have already been promised to states. It's about protecting fundamental rights and access to health care. The defund provision denies access to critical services like STI testing, cancer screenings, contraception, and preventative care. And it imposes a cruel choice on states: either weaken your healthcare system and reduce services as Planned Parenthood centers close, or use your own funds and forego committed federal funds to keep those centers open. This is a matter of coercion and control, and California will not be complicit. Through our lawsuit, we're asking the court to strike down this harmful law and stop the Department of Health and Human Services from putting it into effect. Our goal is simple: to protect the health of millions of Californians and preserve the integrity of our healthcare system. This attack isn't just about abortion. It's about denying vulnerable communities access to care they rely on every day. Planned Parenthood health centers are pillars in our healthcare system. For families and individuals across California and the nation, they provide cancer screenings, STI testing and treatment, contraceptive counseling and prescriptions, vaccinations, routine checkups, and wellness exams. These services save lives. They catch illnesses early. They help prevent disease and protect public health. And for many people, especially those in rural areas or underserved communities, Planned Parenthood is their only source of care. Make no mistake, this provision puts politics ahead of patients. It endangers lives, burdens already strained healthcare systems, and turns Medicaid, a program meant to uplift vulnerable communities, into a political weapon. Access to essential healthcare is a fundamental right, not a bargaining chip to further the president's political agenda. As AG, I'll continue to use the full authority of my office to defend the right to abortion and healthcare as a human right. We'll continue to uphold California's strong laws protecting access to reproductive health care. I want to thank the incredible team in my office who work day in and day out with this mission in mind. I want to say some of their names and call them out: Erica Connolly, Carly Eisenberg, Nellie Palma, James Toma, Christina Bohr-Arndt, Nicholas Green, and Helen Hong, among our great team members getting us to this point today. Thank you all again for being here. And before I take any questions, I'd like to pass it over to President of Planned Parenthood California, the inimitable Jody Hicks.
Thank you, Attorney General Bonta. Thank you for having me today. For months, we have been sounding the alarm on what a federal defund could mean for California, what it would mean for over 100 health centers throughout the state, the footprint we have here as the largest provider of abortion and reproductive health. 1/3 of the patients nationwide are here in California. 1 in 4 people, 1 in 4 women in California have been to a Planned Parenthood health center. And what defunding Planned Parenthood and what that impact would be in California. But unfortunately, they did it anyway. This Trump administration, the backers in Congress have defunded Planned Parenthood in that bill that they love to call beautiful, that is so harmful for Californians. And what does that mean? As the Attorney General pointed out, it's not taking away federal funding for abortion services. They did that a long time ago. This is describing an entity that is Planned Parenthood and saying that all of the services that we provide can no longer receive funding. So it also means that they're taking away the freedom of choice for Medicaid patients, that they can't choose a Planned Parenthood as their trusted and most respected provider for some of their most important decisions, that they're not able to go. Their intent is that they're not able to go to a Planned Parenthood health center and choose Planned Parenthood as their provider of choice. And we know what Planned Parenthood means for the state of California. We know that as one of the largest providers, we provide essential health care to Californians that are most in need. Over 80% of our patients are on Medicaid. So what this means and how it disproportionately impacts people with low incomes, people of color, our LGBTQ community. And that's why it's so infuriating that these members, GOP members of Congress, voted for it anyway. And I just want to be clear, they voted against their own constituents. Here in California, just 3 years ago, Californians spoke loud and clear that we value reproductive health care. And as a matter of fact, valued it so much that it's enshrined in our California Constitution, that people in California have the right to reproductive health care, including abortion, including birth control, and the right to access that care. And so they knew if they took away funding and what is essentially imposing economic sanctions on Planned Parenthood because of policies that they disagree with here in California, they knew what that would mean. And they knew what it would mean to access to care for patients if they were able to get away with that. They've turned their back on California's commitment to reproductive freedom, and they've jeopardized access to countless Californians to the critical and wide-ranging services, as was talked about. We are talking about STI screening, cancer screening, birth control, sometimes prenatal care, care that people rely on here in California. But try as they might, Planned Parenthood will not go away quietly. We are fighting back with every tool that we have. They always underestimate how much people want and will fight for reproductive freedom, especially here in California. So a few weeks ago, the Planned Parenthood Federation of America, representing all of its members across the country, including those in California, sued the Trump administration for their targeted attack on Planned Parenthood. And yesterday, a federal judge issued a preliminary injunction blocking the defund provision, including the 7 Planned Parenthood members here in California. And we are grateful for that temporary relief that this injunction will provide to our California affiliates. But that lawsuit is just one strategy to fight back. And the reality is that an attack this severe requires a multi-pronged response with both short and long-term strategies. These attacks are not going away. And this administration has certainly shown their colors. They've certainly shown what they intend to do, and it's continuing to attack people's reproductive freedom across the country. So Attorney General Bonta's lawsuit against the Trump administration is another key way California is fighting back against this unconstitutional defund. So thank you, Attorney General. Thank you to your entire team for the commitment to protecting reproductive freedom in our state. always steadfast and always makes us feel better. But we also know that with this fighting back, we'll continue to serve patients here in California. We'll never stop fighting to protect California's right to reproductive freedom, the ability to access reproductive health care, the health care that everyone needs and deserves. And as the leading reproductive health care provider in the country's leading reproductive freedom state, we simply have no other choice. And Planned Parenthood is here for good. Thank you.
Thank you, Jody. And just want to share that we are on file with this, with our complaint today in the District of Massachusetts, so it should be available to all the press that are present. We have two claims, both arising out of the spending clause. The first, an ambiguity claim, pointing out the fact that the definitions of what entities are covered and the timing of the enforcement are ambiguous in the congressional statute that's applicable here. Our second claim is around unconstitutionality, pointing out that the First Amendment rights of Planned Parenthood are violated, as well as this congressional statute being a bill of attainder, targeting a specific entity without due process and punishing them. And we, the state of California, administer Medicaid, Medi-Cal in California. And so we are being forced to be complicit in what a judge has already determined are unconstitutional actions. And we won't be, and that's why we brought the case to challenge this bill and how it harms the state of California. I do just want to point out the theme here that shouldn't be lost on anyone who's following our lawsuits. This is a administration that is anti-healthcare, anti-health. Don't talk to me about Make America Healthy Again. They have made it harder to get care through the ACA. They have stripped down and harmed our Health and Human Services Agency, and here they're taking away critical health care that saves lives and makes people healthy because of a political agenda. So this is an anti-health administration shown again, yet again today. So with that, happy to take any questions, and please let us know if you want me or Ms. Hicks to respond.